All right, so this is the last one that I'm going to show you. So, subscapularis. This muscle is on the inside of the scapula, so on the anterior part of the scapula. You can look this up if you want to see a picture of it. Subscapularis is the name of it. So scapula is here. It's actually on the other side of it, so on the side that's facing like my rib cage. So you're really just touching the edge of this muscle when we do this. But I like to rest this left arm on my leg, take my thumb and kind of press it into here. And at the same time, I'm protracting my shoulder. So I'm trying to drop my arm forward, and I can feel it already in the posterior shoulder. So you're going to feel some pain kind of back here. That's the referral. It can also sometimes present around as like a band around your wrist. Some people do feel that, but I mostly feel it in the posterior shoulder when I do this. You want to try to get to some of the fibers up near the shoulder capsule, and then also in the lower belly of this muscle, so sort of towards the bottom of that shoulder blade, but on the inside. And then just hold that for a few deep breaths. Breathe in, breathe out, and sort of let your fingers sink into it. Now, I like my thumb because I can really press into it. Some people don't like to use their thumb for, for obvious reasons, but you can use I call this a blade hand, and you just kind of hold it like this and press into there, and you can get the same thing happening. I just kind of follow my rib cage like this and push back into that. So I'm pushing back like that into my scapula. So that's pretty much it. Now, with this, I want to do some active release techniques. So I'm just going to rotate the arm externally and internally as I hold this. Again, I've said this in other videos, but when you have compression on a muscle and you're doing the active movement with it, whether it's stretching or active release techniques, it's a really good thing, and it really helps it release a lot faster, and it's just more effective. So add that movement in there with that. Okay, so about 30 seconds is all you need to do. When you treat these muscles, I would do all 5 of those in the same kind of round. So, start with the ones that I sent you, like the low mid-trap, the serratus anterior, the pec, the infra, and the subscapularis. And just do all of those a couple of times a day. It doesn't take long, probably takes 5 minutes to go through all of those. And yeah, so hopefully that helps. What else? I think that's it. So hopefully this helps. Give me some feedback. Let me know kind of if it's helping, and or if there's a movement you're still struggling with after doing this for, I give it at least a couple of weeks of consistency. Make sure that you're doing it every day, a couple of times a day, and we'll see if that pain changes at all. Okay.